virtually to adhere to social distancing guidelines. We will now begin our briefing with opening remarks from Mayor Jim Kenney. Mayor, you now have the floor.
Thank you very much, and good afternoon to everyone. I want to start today by sharing some good news. I'm happy to say that we have now reached a tentative agreement with Local 22 for a one-year contract extension, similar to those reached with the FOP and with District Council 47. I'm grateful to Michael Bresnan and his leadership team for their willingness to work with us and develop a deal that makes sense for everyone. The men and women of the Philadelphia Fire Department have been on the front lines of our response to COVID-19, and I'm glad that we've been able to give them this peace of mind at this very trying time. This extension will allow all of us to get through this unprecedented public health crisis, and next year we'll have a better sense of what will work for a longer-term deal. I look forward to ratification by the membership of Local 22. I know many Philadelphians are receiving or waiting to receive their $1,200 federal stimulus check. For many residents who face job loss because of the pandemic, this nominal amount can make a difference. Another part of the Federal CARES Act could also soon help the city. The State and Local Government Stabilization Fund provides direct funding to states and cities to support these governments with expenditures related to the COVID recovery. Yesterday, we submitted the city's application to the United States Treasury to access these funds. The amount each municipality gets is calculated by a formula pegged to the population. Based on that formula, we are anticipating receiving funds to cover upwards of $276 million in COVID-related expenses. We anticipate receiving this in 2 installments, the first one coming this month. These funds will help Philadelphia cover some of what have already become tremendous expenses as we rush to halt the spread of this virus throughout the city. But as thankful as we are to be eligible for this assistance, we need more action from Congress and the White House to help us and other cities and states. Because of these costs and because of the economic downturn resulting from the stay-at-home order, Philadelphia and other cities are staring at a tremendously dire economic outlook. With tax revenues dropping, we are facing the potential of drastic cuts in city services, and we hope new federal aid could help us avoid some of those cuts. We have sent letters to our partners in Washington, making clear that more aid is needed for a host of things like paycheck protection, rental and mortgage assistance, and food and shelter needs. Now is not the time for foot dragging or partisanship in our nation's capital. The needs of cities like Philadelphia are very, very real and very, very frightening. So we urge both the White House and Congress to move with haste in improving further aid. And now for some more positive news. Philadelphians and our neighbors across the region continue to come together to support each other during these difficult times. Starting today, Wawa will provide 10,000 lunches over the course of a 7-week initiative to 2 shelters, St. John's Hospice and Face to Face. This commitment is an extension of the city's Step Up to the Plate collaborative with Broad Street Ministry, Project Home, and Prevention Point Philadelphia to feed our residents who are most in need. Additionally, Wawa has announced the Wawa Foundation COVID-19 Emergency Food Distribution Fund, making available $250,000 for eligible nonprofits and local food banks in need of assistance. As a former PAL kid myself with the Police Athletic League, I'm heartened that Wawa has donated over 600 box meals to PAL families throughout their Gotta Have a Hero program. Yesterday, the PHL COVID-19 Fund announced its second round of grants, awarding more than $2.5 million to 79 nonprofit organizations serving on the front lines of the coronavirus crisis. The fund, launched just 4 weeks ago, has secured $13.8 million in gifts and pledges. As a result, the fund has already granted over $4.8 million to 123 nonprofit organizations, groups that are providing vital services to individuals facing wide-ranging and urgent consequences of the COVID-19 pandemic in this region. And we give a big thank you to Pfizer Foundation for stepping up this week to contribute $250,000 towards this effort. To those who are looking to donate to neighbors in need, if you can visit phlcovid19fund.org. That's phlcovid COVID19fund.org. Thank you to the 3,300 people who have already chipped in and donated what they can towards this effort. These generous contributions from individuals, families, and organizations truly demonstrate the spirit and capacity of the entire Philadelphia region. We've also received a number of product donations to support our first responders and hospital workers. I want to recognize some of the businesses and institutions who have made significant donations of PPE, cleaning supplies, and other resources in recent weeks. The University of the Sciences, St. Joe's University, Urban Outfitters, Giant grocery stores, Metrex, GoPuff, Komodo Holdings Company, Fairmount Hardware, Northeast Community Church, Rebuilding Together Philadelphia, Eisenhower Fellowship, and the Police Foundation. Thank you all for your contributions. We much appreciated. Last week, Philly Counts, the city's effort to support the next United States Census, launched its COVID-19 Community Response Captain Program. So far, they have trained 1,124 people in English, Mandarin, Spanish, and French. The COVID-19 Community Response Captains are trusted messengers in their communities who have the information and resources needed to keep themselves, their families, and their neighbors safe during these challenging times. Thank you to all these folks for relaying the most accurate and updated information to their peers and providing support to them when it is needed. If you want to become a COVID-19 Community Resource Captain, you can pick the session that works best for you based on time and language at the philadelphia.gov/census. It's philadelphia.gov/census. Finally, we'd like to thank the Pennsylvania National Guard for working with our Emergency Operations Center. They've done tremendous work this past week to help feed our most vulnerable populations. On Monday, the Pennsylvania Task Force Support delivered nearly 14,000 meals to the Office of Homeless Services as part of their feeding program mission. Yesterday, personnel transported and unloaded 17 pallets of food consisting of 20,000 meals that will go to our neighbors that are experiencing hunger. These members are from the southeastern Pennsylvania region, so we appreciate their service to their community and to their country. Now I would turn it over to Dr. Farley for his daily update.
Thank you very much, Mayor. The news on the epidemic today is mixed. We're seeing a consistent number of cases identified, but we're seeing continued increasing the number of cases in hospitals. So we'll hear more details. As from yesterday to today, there are 518 new cases of coronavirus infection reported in Philadelphia residents, bringing us to a total of 8,563 since the beginning of the epidemic. Now that 518 is similar to the average of about 500 per day that we've seen over the past week, which says to me that we've hit pretty much a plateau after weeks of increasing number of cases each day. Now I can't say yet that we are seeing any decreases, or if or when we will see decreases in the future. I would just say right now it looks like we're about a plateau, about 500 new cases per day. If you want a better sense of the trends, just check our website, which has a nice graph on this. We're continuing to deal with clusters in congregate settings, including nursing homes and behavioral health facilities, and the jail. The update on the cluster in the city's jail is currently we have 63 inmates who are testing positive. That includes 13 new positives, as we got a bunch of laboratory reports from yesterday, but 9 others who have recovered and been removed from isolation. The number of cases that are being treated in hospitals is growing. Number of COVID inpatients in Philadelphia city hospitals is now 852, and in the Southeast Pennsylvania region, it's 1,633. That number is still increasing. So we're not at the peak yet, and I can't say when we will be at the peak as far as the hospital surge with this epidemic. Region-wide, 33% of our hospital medical surgical beds or normal beds are still available, and 33% of our intensive care unit beds are still available. But it's very spotty. Some hospitals in the region may be at or near capacity, particularly for ICU beds, and they may need to transfer patients or divert patients to other hospitals. Now, we've been setting up the Leocoris Center at Temple University as a field hospital if needed. I visited the hospital today. The staff has done a fabulous job putting it together, and the hospital is ready and capable of treating patients, not patients who need intensive care, but patients who don't need a ventilator. But still, we think that transfer of patients from a hospital that is at capacity to other hospitals is preferable, or we're transferring them to the Leah Course Center. Nonetheless, if we need the Leah Course Center, it is now ready to go. I have to report that sadly, we've had 34 new deaths from the coronavirus infection from this time yesterday, bringing us to a total of 298. Now, some of this 34 is from laboratory testing of deaths that occurred in the past. If you want a better sense of trends, there's also a graph on our website. 149 of those 298 deaths occurred in people who were nursing home residents. So our nursing homes continue to be hit hard in this epidemic. And if you want to know more demographics of the people who died, that's on our website as well. Now, let me talk a little bit about testing, because I know there's a lot of interest in testing. We are still, unfortunately, limited by how much testing we can do, by the number of swabs we can use to collect the sample, by the laboratory capacity to process those samples, and by the delays in reporting, which can take from 2 to 7 days for us to get a result. This very much limits our ability to do everything we want to do in this epidemic. It limits our ability to help nursing homes. It limits our ability to let individuals know if they have infection. It limits our ability to track the epidemic across the city. There are multiple problems, as I said, but we're particularly frustrated by the lack of swabs that we use to collect the sample. So I thought I'd just give you an idea of what I'm talking about when I mention these swabs. I don't know how well this shows up on your screen here, but this is a swab. It's made out of a synthetic material. It's especially made so it doesn't have any DNA on it. It's not contaminated by anything. So this is not something you can replace with a Q-tip or something you could make in your basement. So we need these swabs in order to be able to collect the sample. After you collect the sample, you put it in this tube here, which has a liquid in it, which keeps the virus intact as the sample is transported to the laboratory for testing. We need more of these. We need thousands more of these. We can't get enough of them. And until we have more, the testing we're going to be able to do in Philadelphia will be limited. Now, also, we would very much like to shorten the length of time it takes to get a result. We want more rapid tests available. Now, there is a rapid test that's being marketed by a company called Abbott, which can produce a result in 15 minutes. But I've learned that this test is done by a machine that can only handle one sample at a time. And so you're not going to be able to do an awful lot of samples with this particular machine, even if you have many machines. So that's going to be limited. Now, yesterday I had a question about have we validated the Abbott test yet? Because we want to see how accurate it is. And I said something that I thought was true at the time, but turned out to not be true. I said that we should have our validation results by tomorrow. It's more complicated than I thought. We should have our validation results sometime next week, and then we'll have a sense of how accurate that test is. But even if we have that available, remember there's a limit to how many tests we can do with that particular testing technology. So it's a lot more we need to do to make testing available, which we need to really combat this epidemic. Nonetheless, if you do want to be tested, there are sites that are still available for testing. Go to phila.gov/COVID. There's a lot of detail about whether you should be tested and where you can go and what information you can get if you want to be tested. To everyone that's listening in, the hospital data say that we're definitely not past the worst of this. With the limits on testing, we don't really know who's infected, which that means that you have to assume that anybody that you're seeing has the virus. And that means you should stay away from other people. Stay home. If you have to go out because you're an essential worker, or you have to go to the grocery store or the pharmacy, make sure you're wearing a mask when you're around other people. For more information, again, www.phila.gov/COVID, or if you want medical questions answered, 1-800-722-7112. Thanks.
Thank you, Dr. Farley. We are now going to turn it over to Armando to give a Spanish translation of both the mayor and Dr. Farley's remarks. Armando.
Mensaje del alcalde Jim Kenney para el viernes 17 de abril del 2020. Buenas tardes a todos. Quiero comenzar compartiendo buenas noticias. Me complace informar que hemos alcanzado un acuerdo tentativo con el sindicato local 22 para una extensión del contrato por un año, similar a los acuerdos alcanzados con el Fraternal Order of Police y el sindicato DC47. Mi gratitud va para Michael Branson, lograr un acuerdo beneficioso para todos. Los hombres y mujeres del Departamento de Bomberos de Filadelfia han estado en la primera línea de respuesta a la crisis por la COVID-19 y me alegra haber podido traerles algo de tranquilidad en un momento tan difícil. Esperamos la ratificación de los miembros del Local 22. Sé que muchos habitantes de Filadelfia han recibido o esperan recibir sus cheques de estímulo federal de $1,200. Para muchos residentes que han perdido sus trabajos debido a la pandemia, esta cantidad nominal puede marcar la diferencia. Otra parte de la ley federal, CARES, podría ayudar pronto a la ciudad. El Fondo de Estabilización del Gobierno estatal y local proporciona fondos directos a los estados y las ciudades para apoyarles con los gastos relacionados con la recuperación de la COVID-19. La cantidad que obtiene cada municipio se calcula mediante una fórmula vinculada a nuestra población. Y ayer le presentamos una solicitud al Departamento del Tesoro de los Estados Unidos para acceder a esos fondos. Según esa fórmula, anticipamos recibir fondos para cubrir más de $276 millones en gastos relacionados con esta pandemia. Y esperamos recibir esta cantidad en dos partes. La primera, en este mes de abril. Estos fondos ayudarán para que Filadelfia cubra algunos de los enormes gastos en los que hemos incurrido para detener la propagación de este virus en la ciudad. Estamos agradecidos por contar con esta ayuda, pero necesitamos más acciones del Congreso y de la Casa Blanca para poder ayudarnos. Debido a la recesión económica resultando de la orden de permanencia en casa, Filadelfia y otras ciudades comparten un panorama económico extremadamente serio. Con la caída de los ingresos fiscales, nos enfrentamos a la posibilidad de tener que hacer recortes drásticos en los servicios que presta la ciudad y esperamos que la nueva ayuda federal pueda ayudarnos a evitar algunos de esos recortes. Hemos enviado cartas a Washington para aclarar que se necesita más ayuda para una gran cantidad de cosas, como por ejemplo alimentos, protección de cheques de pago, asistencia en los pagos de alquileres e hipotecas, entre otros. Pero este no es el momento de favoritismos políticos. Las necesidades de ciudades como Filadelfia son muy reales y son aterradoras. Y ahora, algunas noticias más positivas. Los habitantes de la ciudad y nuestros vecinos de la región continúan apoyándose mutuamente durante estos momentos difíciles. A partir de hoy, Wawa proporcionará 10,000 almuerzos durante 7 semanas a 2 refugios, St. John's Hospice y Face to Face. Este compromiso es una extensión del programa A Step to the Plate, en colaboración con Broad Street Ministry, Project Home y Prevention Point Philadelphia, para alimentar a nuestros residentes más necesitados. Además, Wawa ha anunciado el Fondo de Distribución de Alimentos de Emergencia COVID-19 de la Fundación Wawa, que pone a disposición $250,000 para organizaciones sin fines de lucro, elegibles y a bancos de alimentos locales que necesitan ayuda. Ayer, el Fondo PHL COVID-19 anunció su segunda ronda de subvenciones, otorgando más de $2,5 millones a 79 organizaciones sin fines de lucro que trabajan en la primera línea atendiendo a nuestros residentes más afectados por la crisis. El fondo, lanzado hace solo 4 semanas, ha recaudado ya $13,800,000. Como resultado, el fondo ha otorgado más de $4,800,000 a 123 organizaciones sin fines de lucro, a grupos que brindan servicios y a personas que enfrentan las consecuencias de la pandemia del COVID-19 en la región. Gracias a los más de 1,300 personas y organizaciones que han contribuido. También hemos recibido una cantidad de donaciones de equipos de protección personal para apoyar a nuestros socorristas y trabajadores sanitarios. A la University of Sciences, St. Joe's University, Urban Outfitters, Giant, Mitrex, GoPuff, Komodo Holdings Company, Fairmount Hardware, Northeast Community Church, Rebuilding Together Philadelphia, Eisenhower Fellowship y Police Foundation, muchas gracias por sus contribuciones. La semana pasada, Philly Counts, la iniciativa de la ciudad para apoyar el próximo censo de los Estados Unidos, lanzó su programa de respuesta comunitaria COVID-19. Hasta la fecha, se ha capacitado a 1,124 personas en inglés, mandarín, español y francés. Los capitanes de respuesta comunitaria COVID-19 son mensajeros confiables en sus comunidades que cuentan con la información y los recursos necesarios para mantenerse a sí mismos, a sus familias y sus vecinos informados y a salvo durante esta crisis. Gracias a todas estas personas por transmitir la información más precisa y actualizada a la gente y por brindarles el apoyo necesario cuando lo requieren. Si desea inscribirse para ayudar como capitán de respuesta comunitaria del COVID-19, puede elegir la sesión que mejor se adapte a usted en función de su tiempo y su idioma en fila.gov/census. Finalmente, nos gustaría agradecer a la Guardia Nacional de Pensilvania por trabajar en nuestro centro de operaciones de emergencia. Han hecho un excelente trabajo apoyándonos y ayudándonos a alimentar a nuestros pobladores más vulnerables. Juntos estamos enfrentando esta tormenta. Muchas gracias. Y ahora, la actualización en materia de salud al viernes 17 de abril del 2020. Desde ayer se han confirmado 518 nuevos casos de coronavirus en Filadelfia. Actualmente tenemos un total de 8.563 casos en la ciudad. Desde la semana pasada hemos tenido un promedio de 500 casos diarios. La ciudad viene monitoreando de cerca toda esta información, pero todavía no podemos afirmar que estemos viendo disminuciones en los casos. Tenemos 13 casos positivos de COVID-19 entre los reclusos, con un total de 63 casos registrados y 9 internos que se están recuperando satisfactoriamente. Los hospitales están monitoreando el aumento de los casos. En total, hay 852 pacientes que están hospitalizados en Filadelfia y 1.633 pacientes que están hospitalizados en la región sureste de Pensilvania. Reportamos, tristemente, 34 nuevos fallecimientos en Filadelfia, por un total de 298 personas que han muerto por la COVID-19. 149 de estas muertes, es decir, el 50%, se han producido en hogares de ancianos, porque este virus no discrimina por raza ni por género. Las pruebas están disponibles, pero son limitadas. Hay retrasos en el reporte de casos positivos y estamos frustrados por la falta de hisopos para poder recolectar las muestras. Quisiera hablarles ahora de la prueba rápida del laboratorio Abbott. Los resultados se obtienen en solo 15 minutos, aunque las máquinas solo procesan una prueba a la vez. Les proporcionaremos mayor información sobre estas pruebas la próxima semana. Usted puede encontrar información sobre los centros de pruebas en fila.gov/COVID-19, pestaña FAQ. Los datos recibidos de los hospitales nos indican que aún no hemos pasado la peor parte de esta crisis de salud pública. Tenemos que acatar la medida de permanecer en casa para estar seguros, porque el virus sigue circulando en nuestro ambiente. Si no respetamos la orden de permanencia en casa, el virus se propagará rápidamente. Si debe salir a trabajar, le recomendamos mantener la distancia social de 6 pies, lavarse las manos y usar máscaras de tela en lugares públicos donde sea difícil observar las medidas de distanciamiento social. Le invitamos a consultar el sitio web para mayor información, www.fila.gov/COVID-19. Recuerde usted que puede llamar al 311 si tiene preguntas sobre la COVID-19. Hay servicios de traducción disponible en 100 idiomas. Y si tiene preguntas de carácter médico, puede llamar las 24 horas del día, los 7 días por semana, al 1-800-722-7112. Y esta llamada es gratuita. Gracias.
Thank you, Armando. We will now move to our Q&A portion for members of the press. I'd like to ask that all of our speakers join us again with audio and video. Please remember, we do have a limited time for these briefings. We're only allowing one representative from each media outlet permitted to ask questions. And we ask that you please limit your questions to 3 or fewer. We will do a second round of questions if time permits. So for those logged in today, please use the raise your hand feature. It can be found under the participants list. We also ask that you use video to ask your question if you are able, and we will unmute you one by one to answer your questions. So first, we will start with Mitch Bucker of NBC 10. Mitch?
Thank you. Mr. Mayor, I want to ask you a question about the president's phase plan. If the governor goes to a new phase of the opening plan, does that mean that the city would automatically follow?
It doesn't mean automatically. We've had a great relationship with the governor. We've also been with the southeastern region counties. There's a phone meeting every day with them. And the governor understands that Cuyahoga and Cambria County and other counties in the center of the state in the northern tier are different issues than Philadelphia or Montgomery County or Delaware County. So the governor, I don't know if he was supposed to announce today. I talked to him. He said he wasn't announcing until Monday unless that's changed. So between now and over the weekend, we'll be able to articulate our concerns. And I believe he will incorporate our concerns into his announcement.
Sir, how does the city's dire financial situation play into your decision to reopen business?
It doesn't at all. I think people staying alive and not being ill is more important. And although we are concerned about it, and we're going to have to deal with it at some point in time, relatively soon, people's lives are more valuable than the dollar.
Thank you. I have one question for Dr. Farley. Dr. Farley, do you have enough testing to get an accurate picture of the true number of cases and if that number is dropping?
Short answer is no. We know that we're only testing a fraction of the people who have symptoms. We know we're only identifying a fraction of the cases. If that fraction is consistent, then we can get a general idea of the epidemic wave, but we can't get a precise number. I think our general idea says that the epidemic has plateaued but not fallen yet. I think that that's probably accurate, and even if we had more tests, we would come up with the same conclusion. But if we had many more tests, we'd have a much better picture of exactly where the epidemic is.
Thank you, gentlemen.
Thank you, Mitch. We're now going to go to Layla Jones with Billy Penn.
Hello, hi. I had two questions. My first is from a reader. How has COVID-19 affected the prison commissary supply chain? Has there been any delay in inmates receiving their purchased items? Many incarcerated people depend on the commissary for food or snacks.
To my knowledge, it hasn't had any impact on the commissary. We'll confirm that, but again, food is being delivered to our inmates in their cells, so we don't expect that to be an issue, but we'll confirm on commissary items.
Thank you. And I have a question for Dr. Farley. Dr. Farley, do you agree with health experts that widespread testing is needed in order to reopen the economy? And have you spoken with Governor Wolf or Dr. Levine about this?
I absolutely believe that we need to have widespread testing and more testing in order for us to open the economy. And I speak to Dr. Levine all the time and have voiced that concern to her, but I feel the same way.
Okay, thank you guys.
Thank you, Layla. We will now go to Sean Walsh with the Inquirer.
Thank you. I have a question, I think, for Dr. Farley or for Brian. What would happen if a nursing home or a senior facility is just truly overwhelmed, like the one everyone's heard about in North Jersey, if it really couldn't deal with the size of the outbreak in its facility? Could the city step in to help it? Is there a plan along those lines?
Let me start out, and then I think I can turn it over to Brian. We're helping nursing homes now to try to not get to that point, and that's the really key emphasis. It's much better to prevent that kind of problem than have it happen. And the way to do that is to try to prevent the infections from spreading, and we're giving them technical advice on that. And then we're seeing if there are ways that we can help them, those that are short-staffed. We've put out notes to our medical reserve corps to see if any of them are interested and willing to supplement the staff of nursing homes. We'll see if that helps out. And we're staying in close contact with them.
And just to kind of piggyback on what Dr. Farley said is, we saw a nursing home in Montgomery County face evacuation. So we are certainly planning contingencies if and when that should happen. But I think we are confident in our ability to plan to make sure that doesn't happen. I think that is, again, that's a contingency planning. Hopefully it's just an exercise, and that all the work that Dr. Farley and his team are doing, make sure that it's never needed.
Okay, gotcha. Are there any cases in the city-owned Philadelphia nursing home? Let
me get back to you on that, if I could.
Okay, sounds good. And then lastly, Brian, could you provide any more details on the Local 22 deal? Did it include raises of 2 or 2.5% or any other adjustments to the current deal?
Yeah, I think the mayor touched on that in his remarks. It's a 2.5% raise. If are there other details that you're looking for?
Just any other significant changes from the current CBA that they have?
There weren't any additional significant changes. We can certainly get you a copy, but no significant changes. Mayor, did you have anything to add?
Not that I'm aware of, no.
Yeah.
Thanks very much.
Okay, thank you, Sean. We're going to go to Howard Monroe with CBS 3 now. Howard?
This question is for the mayor and also Dr. Farley. What needs to happen before the president's plan of opening up the country could actually happen here in Philadelphia? I mean, from a planning point to also a health point for folks who may be wanting to get out of their homes and go out there and take part in this in the city.
I know Dr. Farley have more extensive answer. Testing, tracking, and quarantine. I mean, I think those are the three major issues we have to get to so that we can figure out how to control and contain the virus. We don't know who has it, and we don't know who they've come in contact with, and we can't quarantine them. The virus will stay out there forever until we get a vaccine.
Just to reemphasize that, when the virus first hit Philadelphia, we tried to test and identify cases and then follow up on them. But we didn't have the testing available. And so it spread before we could have a chance to identify those cases and do the contact follow-up. So we were left with just the social distancing. If we don't get testing available, we're right back in the same boat. We have to be able to quickly identify cases and quickly make sure that those cases don't spread it to others so that we don't have it cycle up as it did last time.
Also, my next question is, last night on CBS, we aired some video of some homeless people who were sleeping in the airport terminals. To our understanding from what we were told is that this is part of city policy. The question is it safe for homeless people and also for the workers to be sleeping in airport terminals? Is that safe for the workers, and also is it safe for the folks who are sleeping there?
First of all, it's very important that this is not a city policy. Most people are showing up there as they did when the airport was fully functioning. And I think just out of compassion, we've allowed them to stay there without moving them. But we're not moving or encouraging people who are unsheltered to go to the airport. They wind up there anyway as a matter of normal course of their activity. There's a homeless population that frequents the airport, and we've just allowed them to stay in shelter during this crisis. I don't believe that it has any impact on the safety of the workforce. Brian, from an operational standpoint, maybe a bad.
Yeah, no, agreed. I think we're doing our best efforts to make sure that those folks are maintaining social distance. Homeless outreach is there on a regular basis to try and encourage those individuals to get into shelter. Certainly the safety of our residents, whether they're unsheltered or not, and the safety of our workers are paramount to all of us. And we're doing everything we can to make sure that is maintained.
And they're not necessarily all Philadelphians. I mean, the airport is located in two-thirds of it in Delaware County. So these may be folks coming from the region, not just from Center City, Philadelphia, or from neighborhoods in Philly.
And also my last question is, if this testing can be done and we can reopen the city, are there any conversations going on now with the Sixers or with the Phillies about reopening some of those sporting venues in South Philly?
Honestly, I mean, I love the Phillies and I love the Sixers. I love the Eagles and all of our sports teams. That's probably the last most important thing on our list right now in the upcoming couple of days. I mean, we understand that putting 40, 50, 70,000 people in one location together that close is really a recipe for disaster unless there is some vaccine or we know for sure that the virus is under control. There's nothing more I'd rather do than go to a Phillies game some nice afternoon, but I don't see that happening anytime soon.
Thank you.
Thank you, Howard. We're now going to go to Yaima Crispo with Telemundo.
Mi pregunta es para Armando y es sobre qué directrices va a seguir la ciudad en términos de la reapertura, si va a seguir directrices federales, estatales, ¿cuál es el plan?
My question is, what guidelines are going to be observed for the reopening of the city? Are we going to be following the federal or the state guidelines?
Doctor?
No, we're going to be working with our partners at the state level and our partners at the regional level to see if we have the proper protections in place to reopen and what's the safe way to reopen gradually. So we haven't worked those out, but our cue is really going to be with our regional partners and the governor's office.
Vamos a trabajar conjuntamente con nuestros socios a nivel estatal y a nivel regional para observar las protecciones que sean seguras. Vamos a trabajar con ellos.
¿Y qué planes hay, ya que se están llenando los hospitales, de potencialmente abrir más hospitales de campaña? Si hay planes en otros lugares en términos de los hospitales.
And what are the plans that you have in contingency now that hospitals are getting filled? Are you planning on having field hospitals or hospitals in other places?
Well, we're tracking very closely the availability of beds across the entire region. And while there's some hospitals that are near capacity, that there are other hospitals that have plenty of available beds, including intensive care unit beds. So the first step is, if hospitals are near capacity, to transfer patients to other hospitals in the region. If that isn't possible for some reason, then we do have the Leah Center, which is open and available now for patients who don't need intensive care. And between those two, we feel like we're going to be able to ride through this.
Estamos haciendo un seguimiento de los casos y vamos a ver la disponibilidad que hay en la región en general. Hay hospitales que están cercanos a cumplir con su capacidad, hay otros que tienen bastante espacio todavía disponible en unidades de cuidado intensivo. La primera línea sería una transferencia de esos lugares a los otros. Fuera de eso, tenemos el centro Leah Cures, que está abierto y disponible para los casos que no requieran cuidados intensivos.
Y por último, hemos recibido muchas quejas de trabajadores que dicen que las condiciones en sus centros de trabajo son precarias, no se les está ofreciendo protección. Hay otros empleados que han dado positivo. ¿Qué recursos hay para los trabajadores reportar estas condiciones y que se tome alguna medida?
We have received complaints from workers about their working conditions, which are unsafe. They've not been offered protections, and some of their co-workers have turned out to be positive. What measures are there in place to address this?
What workers?
¿Qué trabajadores?
They're workers at grocery stores, different stores. We're getting a lot of complaints about that.
Hemos recibido que trabajadores en bodegas y en tiendas de ventas de alimentos.
Sure. So the governor did issue an order earlier this week that provided broad protections for workers at essential businesses or life-sustaining businesses and for customers. Things like wearing masks, putting up additional shielding to protect workers, working on a staggered schedule. All of those things should assist with workers, and many of our businesses have already done that voluntarily. That regulation is difficult to enforce, but the city will certainly do what it can to enforce the rules. But again, the capacity for enforcement and the complexity of the issues that they presented is going to be challenging.
Efectivamente, anteriormente esta semana el gobernador de Pensilvania dictó ciertas medidas para proteger en este sentido a los trabajadores, a los negocios y a sus clientes, con medidas que incluyen el uso de mascarillas o máscaras, con cubiertas de los elementos al lugar de acercarse a la caja, por ejemplo, y con jornadas alternas de trabajo. Por supuesto que esto es algo que se está haciendo de forma voluntaria y es difícil de hacer cumplir, es difícil de hacer observar. Para nosotros va a ser un reto el hacer que la ciudad pueda monitorear esto y hacer cumplir con estas disposiciones.
Okay, that's it for me.
Gracias.
Thank you. We'll now go to Gray Hall of 6ABC. Gray?
Okay, thank you so much. I guess the first question is more than likely for the mayor. Considering the fact that the president had said that many states can open by May 1st, and there are some, at least Jacksonville, Florida beaches there will be opening, I think, by this evening. I'm assuming that May 1st is totally unrealistic for the city of Philadelphia to be open. Have you thought about a date or a deadline, what that would look like?
Well, I mean, I know you're posing the question to me, but I think the question should be answered by Dr. Farley, because that's whose advice we're going to listen to when it comes to whenever we open.
So we are absolutely not talking dates right now. I know that's difficult for people. The uncertainty of this is really tough, but we need to have certain conditions in place in order for us to reopen safely. If we can't test enough people to know where this virus is, then we can't reopen the economy. And I hope other states that are thinking about reopening are considering that for themselves as well as for us. If they reopen quickly and they can't test, they may get a big surge of infections, which is going to hurt their populations as well as ours.
And actually hurt business even more than it's being hurt now. If we have a huge surge because we don't test, we don't track, we don't quarantine, and we open and we go sliding backwards, the economy is going to take even a double hit.
So in that respect, Dr. Farley, with no dates, no timeline, do you take this week by week, day by day in terms of, because I know a lot of people are itching to get out, but we know safety is a priority. So how are you measuring that? Is it week by week, day by day, month by month?
I'm looking at things day by day. You see, we're reporting every day how many cases we see. So we're looking at that epidemic curve. Right now at 500 cases a day, frankly, even if we're testing everybody, we know we can't do the contact tracing for 500 people a day. It's going to have to get to a much lower level for us to be able to quickly identify those contacts and make sure that we stop the chain of transmission. So we're going to have to get to that low level. And so it really, we are just going to have to follow it day by day. And again, I know that's really tough for people, that everybody's cooped up inside. They just want this to be over with. I want it to be over with too. But I remind everybody, if we went back to our way of living before, this absolutely would get much, much worse.
Thank you so much.
Okay, thank you, Gray. We're going to go to Pat Loeb with KYW. Pat?
Thanks. Dr. Farley, why are swabs in such short supply, and is there anything that can be done about it?
So I got an idea. We have great journalists on the call today. I wish someone would try to find this out for me because I don't know the answer to it. There's a limited number of manufacturers that are making this in this country, but we've known for about the past 2 or 3 months that this was going to be a problem. And so I don't understand why we can't get more of them. So I wish one of you would run a story on why.
Do you know who does manufacture them?
I got a couple of swabs here with some names of companies. I'd be happy to give them to you.
Thanks. And would you say it's as big a problem as the lack of PPE?
Yes.
Okay. Thank you.
Okay, thank you, Pat. We're now going to go to Jason Peters of Philly Weekly.
Hello, my question is for Director Abernathy. It's about the prisons. In a facility like the detention center on State Road, where the inmates are in like cage-like units with bunk beds, is distancing possible?
No, and we've never said that it is. So we are treating the prison as a quarantine. And so prisoners do have limited movement. We have provided cloth masks to all of our inmates and correctional officers to limit the spread of the disease. We've encouraged washing. Food is taken, food and medicine is delivered directly to individual cells, and movement is limited to showers and phone calls. So we recognize that like any congregate facility, it's very difficult to manage, but we're certainly following CDC guidelines as it relates to correctional facilities, and are doing, I think, are doing well in managing the infection.
Okay. Recently, it came out that a lot of inmates are going to be released. Do you have any ways that recently released inmates can get tested after leaving the facilities?
So inmates, like the general population, first of all, we're only encouraging testing should people be symptomatic. As Dr. Farley outlined in detail, is that tests are extremely limited. And so we want to make sure that tests are provided to those that are symptomatic. We are also asking for any city-related tests that those tests be focused on people over the age of 50. Again, those who are most susceptible to the illness itself. Anyone who is showing symptoms should self-quarantine, stay at home, and treat their disease or treat the illness. And certainly if they have any trouble breathing, they should immediately get to an emergency room and a hospital to seek medical care. But we are not providing tests upon release. But we once someone is released, that individual is just like any other person in our communities, and trying to provide guidance to them. We are certainly providing information to our inmates, so they are educated upon the release.
Okay, that's all for me.
Great. Thank you, Jason. We are going to go to our second round. So if we have any final questions here from anyone else. Okay, we have Claudia Vargas with NBC 10. Claudia.
Hello. I was curious why the city is not releasing the names of the inmates being released as a result of COVID-19.
At 1 p.m. Thank you all.